In tonight's Health Edge, a warning for those of you who take pain relievers like Advil, Aleve, and Motrin.
Chief Health Editor Dr. Partha Nandi joins us now with why you should look closer at the label before popping one.
Yeah.
Doc, Motrin's a way of life when you
I know
have an
millions
ache or
of
pain.
people are taking it, so this is very important. That's the FDA's plan to change the warning labels. This is because the FDA says these drugs can elevate your risk of heart attack and stroke by up to 50%. Now, this applies to prescription anti-inflammatory drugs, also known as NSAIDs, which are not steroid-based. The wording on the label will change, dropping the may, noting instead that the drug does increase your risk of heart attack and stroke, and researchers are finding that this begins with the very first dose. Now, the FDA's warning also includes arthritis medications like Celebrex. Plus, the agency is planning similar changes on labels to those over-the-counter drugs like Advil and Motrin. So, you know, it's pretty important.
I mean, so what do you do? I mean, people with back pain, leg pain, they're popping Aleve, I mean, daily just to get through the pain and work.
So this is the whole issue, that there's millions of people taking it. So what should you do? You should take the lowest dose. Doesn't mean that we stop taking it completely. Talk to your doctor. If you have risks for heart disease or stroke, if you've had a heart disease, if you've had heart attacks or stroke, talk to your doctor. But use the smallest dose. I still think it's a safe drug. Just have to be careful.
And with that history, heart attack, stroke, what can you take if you need something?
Yeah, so people say, so what do I do now if I have it? So Tylenol is a great choice, and then talk to your doctor. Sometimes, you know, I'm not advocating for using narcotics all the time, but in this case, maybe a narcotic may be a good choice because some arthritis is crippling. For those of you who have it, you know what that means. You can't walk, you can't do anything, you can't shop. So talk to your doctor. The main thing is work with your doctor as a partner, saying, listen, I heard about this on Channel 7. Does that mean I'm going to get a heart attack? That's not the case. They looked at these studies and use the smallest dose and work with your medical professionals.
If you don't need it, don't take it.
If you don't need it, don't take it. Don't pop it like it's nothing.
Absolutely. Thank you so much, Dr.
Oh, it's my
Nandi.
pleasure.
All right, and if you have a question or a health concern for the good doctor, you can email him at drnandi@wxyz.com or send it to us on Facebook or Twitter.